What is reassuring is that it's only a very small proportion of those individuals are winding up very sick or in hospital or dying. Some of that is people been reinfected who've been previously had a natural infection. Some of that is people been reinfected who had a vaccine. But what we do see is that those people who've had a full course of vaccination previously, while they may become reinfected, have a significant level of protection against severe disease and death. And that's very important for people to understand right now, is that the protection is there. And you have the possibility of being reinfected, yes, and everyone talks about, oh my God, the vaccines have failed because my brother or my sister or my friend down the road had another infection. I've had colleagues and friends of mine who had a pretty severe infection with Omicron, and my view is I am so glad they had the vaccine, because I'm wondering to myself, how sick might they have been if they hadn't had the vaccine before? And I think people need to consider that while the vaccine may not prevent illness, I would rather have an illness that puts me in bed for a few days rather than have an illness that puts me 6 foot in the ground. And unfortunately, that's the reality. For people who are unvaccinated, Omicron still represents a massive threat to their life and a massive threat to their health. And people should really look at this in terms of really seriously consider getting out there and getting vaccinated. And this is not just a story for the developing world. There is huge inequity in vaccination still, but this is also, in many industrialized countries, there are pockets of individuals who don't have access to the vaccine or who refuse vaccine. And I think at this point, it's really important, given what we're seeing with Omicron, that people do everything in their power to get vaccinated, especially if they're offered that vaccine.